Okay, our lecture today is going to be on acid-base imbalance. ABGs is what you will normally hear them referred to, or arterial blood gases. What are arterial blood gases? They provide information on respiratory and metabolic acid and base electrolyte homeostasis. They're also used to assess oxygenation and the adequacy of that in our body. Okay, so what are our components of ABGs? pH, or the hydrogen ion concentration, and that tells us if it's acidic or alkalotic. We have the PCO2, or the partial pressure of the carbon dioxide, the bicarbonate, which is the HCO3, and partial pressure of oxygen, or the PO2. Homeostasis always wants to occur in our body, so that means that we always want to keep our pH normal, and your pH is going to be your key whenever we read our ABGs. The mechanisms that help to keep that normal consist of buffer systems, which are your kidneys and your lungs, and that's where the bicarbonate and the CO2 come into play. The PO2, or your partial pressure of oxygen, it primarily measures the effectiveness of the lungs in pulling oxygen into the bloodstream from the atmosphere. That's what your PO2 is, and it reflects the amount of oxygen that is dissolved in your blood. Okay, so let's look at our pH. What is normal pH? It is 7.40. Our normal range of pH goes from 7.35 to 7.45. So right in the middle is perfect, 7.40. Your pH measures the amount of acids and buffers, or the base, that is present in your body. If we have an increased pH, that means we have alkalosis. If we have a decreased pH, that means we have acidosis. So how do I remember this? When we make a number line, 7.35 comes before 7.45, and obviously 7.40 is in the middle. When we make an alphabet line, A comes before B. So we can think of it this way. When making a pH line, A is for acid, B is for base. So your acid would be 7.35, your base would be 7.45. So let's interpret these pH values. Okay? Look at these and try to decipher if they are an acid or a base. Remember that our perfect was 7.4. So our range is 7.35 to 7.45. So look at 7.29. Is that higher or lower? And if it's lower, would it be an acid or a base? And if it's higher, would it be an acid or a base? Refer back to the previous slide if you need to see on which end of the spectrum would be the acid or the base. Go ahead and do this for all four on this slide. I would pause this, see if you have the correct answers, and then I'm going to give you the correct answers. For 7.29, that is below our perfect pH of 7.40, so that would be an acid. 7.56, that is greater than 7.45, so that's on the high end. That's on the B, so therefore it would be a base. 7.21, that's on the lower end. That's below 7.40, so that would be an acid. The 7.46 obviously is up, so then that would be a base. And how did you do regarding those? Okay, so now let's look at our PCO2. It's our partial carbon dioxide. Our normal is 40. Our range again is 35 to 45, and then if you'll remember, our pH was 7.35 to 7.45, so now we have just the 3,5 to 4,5. It's an easy way to remember those numbers because these are values that you guys will have to remember. The PCO2 reflects the ventilation capability of the lungs. So that's where the lung part comes in. A while ago I told you that there was a buffering system. One was the lungs, one was the kidney. So the PCO2 is referring to the lungs. CO2 is an acid. So if we have an increase in CO2, we're going to have acidosis. And if we have a decrease in PCO2, then we would have alkalosis. So this is just opposite of what you just learned with the pH. Whereas if the pH is increased, it's alkalotic. And if it's decreased, it's acidotic. But with the CO2, it's opposite. And then if it's increased, it's acidotic. And if it's decreased, it's alkalotic. Alright, and this slide shows you that they do have an inverse relationship, which is what I just told you. As the PCO2 increases, your pH will decrease. And that shows acidosis because a decrease in pH is acidotic, an increase in CO2 is acidotic, so you have acidosis. As your PCO2 will decrease and your pH increases, then it would be alkalotic. It just goes in the opposite direction. Okay, so let's interpret these PCO2 levels. Remember that your range, your normal range, goes from 35 to 45, with your normal being 40. So look at this slide. Go ahead and pause it. Try to figure out if these are an increase or decrease for your pH. If your PCO2 is elevated, will your pH be elevated or will it be decreased? So look at these four numbers, pause this slide, write the answers down, and I will tell you the correct answers on the next slide. Alright, so here are your answers for interpreting PCO2 levels. So you can look to see if you got those right. 57 is elevated. It's higher than the 45, so that means that my pH is going to be lower. It's going to decrease. So if I have a PCO2 of 31, that's lower than my range. It's lower than 35, so that means my pH will increase. They're just opposites. So if my PCO2 is 48, that's higher than my range top number, which is 45, so that means my pH will decrease. And then again with the 40, remember 40 was right on the line, it was right in the middle, and that is normal. So there won't be an increase or decrease. Now we have the third component, the HCO3. The normal range of this is 22 to 26. It reflects the metabolic renal system. So the PCO2 was your lungs, and the HCO3, or you'll hear it referred to as the bicarbonate, is your renal system. It is a buffer. It's the base. Okay, we said that the PCO2 or carbon dioxide is an acid, and the bicarb is your buffer or your base, which is the HCO3. So this one is going to be, if you have increased, you have alkalosis, and if you have a decrease, then you have acidosis. They have a direct relationship with the pH. Bicarb increases, pH increases. You have alkalosis. Because remember, back to your pH, if it was elevated, then it was alkalotic, and if it was decreased, then it was acidosis. So if we have a decrease in our bicarb, our pH will also decrease, which means that we will have acidosis. Alright, so go ahead and try to interpret these levels and look at them. If our bicarb is 30, will our pH be elevated or will it decrease? Will it increase or decrease? If it's 19, is that high or low? Will it increase or decrease? You need to remember that your bicarb has the same relationship with pH as far as increasing or decreasing, and your PCO2 has opposite relationship with your pH as far as increasing or decreasing. And then this slide will show you the correct answers. If my bicarb is 30 and my normal bicarb, remember, was 22 to 26, so 30 is higher than 26, so that means it's an increase, and because my pH has a direct relationship with the bicarb, if it goes up, my pH will as well, so that means I have an increase. The 19 is lower, so it will decrease. The 27 is greater, so it will increase. And the 24, that's within that normal range of 22 to 26, so we have a normal reading with that. So when you hear these terms, you'll hear them interpreted this way. Respiratory alkalosis is when our pH elevates because the PCO2 decreases. Remember, I said your CO2 is your respiratory or your lungs, and your bicarb or your HCO3 is your kidneys. So that's how you're going to tell if it's respiratory or metabolic. You have those two different terms there, your respiratory or your metabolic, so that's how you'll tell those apart. And then your alkalosis and your acidosis depends on the numbers that we're dealing with and how it correlates to your pH. Respiratory alkalosis would be when the pH elevates because the PCO2 decreases. Respiratory acidosis, when the pH decreases because the CO2 increases. They have opposite relationship, and it's respiratory because then when we talk about metabolic imbalances, the metabolic alkalosis is going to be related to the bicarb or the HCO3. When the pH increases, our bicarb is also increased. Remember, they have the exact same relationship. One goes up, the other one does as well. Then we have metabolic acidosis, and that would be when the pH and the bicarb decrease. The golden rule. Always remember this, and it will help you in interpreting them. The system that matches the pH is the cause of the problem. The system that matches the pH is the cause of the problem. Okay, so let's figure this out. Up here we have our ranges. Our pH is 7.27, our PCO2 is 68, and our bicarb is 30. So the very first thing that you have to do when you're trying to read these is figure out what your pH is. So, is your pH an acid or a base? So write that down on a piece of paper beside you and decide. Is that pH level of 7.27 acid or base? Is it acidic or alkalotic? The second step that you want to do is find the cause of the abnormal pH. So now you're going to look at your CO2 and your HCO3. Is the CO2 an acid or a base? So look back up at your CO2. It's 68. Remember that your range for CO2, PCO2, was 35 to 45. So is 68 in that range? Is it higher or lower? CO2 was an acid, so that if it's raised, it's going to be acidic. If it's lowered, it's going to be alkalotic. So is your PCO2 of 68 an acid or a base? Write that down. Then we look at the bicarb. Is your bicarb acid or base? Your bicarb is 30. Remember, your range on your bicarb was 22 to 26. Tell me what that is. Write it down on a piece of paper. Okay, now that you've written these down, you need to look at them and decide if it's caused by the respiratory or the metabolic. Is it the kidneys or is it the lungs that is causing the problem here? Okay. And then fill in the blanks, and the next slide I have the information written on there for you. So try to figure this out, pause it, and then we'll go to the next slide. Okay, on step 1, we said, is our pH an acid or a base? So you should have gotten an acid. 7.27 is below the range of 7.35 to 7.45. And if our pH is low, it's acidic, so therefore the answer to that question is acid. Step 2, find the cause of the abnormal pH. So then we look at our PCO2. Is that 68 elevated or is it decreased? And does that mean that it is an acid or a base? PCO2 of 68 is greater than our range of 35 to 45, so that means it is acidic. Then we look at our bicarb. Is it an acid or a base? And we have a bicarb of 30, so that means it is a base because it is higher than our 22 to 26 range. And you remember that if your bicarb is elevated, it is alkalotic, and if it is decreased, it is acidotic. So now that we have this written down with our pH of acid, our PCO2 of acid, and our bicarb of a base, which of those match the pH? Which one of the PCO2 or the HCO3 matches the pH? The pH is an acid and the PCO2 is an acid, so those two match. And since PCO2 is related to my respiratory system, that means the respiratory system is causing my problem. And another way of wording this would be that we have respiratory acidosis. So pause your slide, look at these ranges, these numbers, and try to figure out what the abnormality in these are. Okay, so here's our interpretations from the previous slide. When we look at our pH of 7.67, is that alkalotic or acidosis? That's alkalosis. It is below the 7.35 to 7.45 range. So we know that it's alkalosis. Our PCO2 is 20. Is that in normal range? Is that higher or lower? That is lower than our 35 to 45 range. So we know that that is also going to be alkalosis. And we look at our bicarb. Our bicarb is 23. That's actually a normal reading. So we know that our CO2 is the one that is causing the problem. CO2 is respiratory, so that's where we get the respiratory label. Then when we look back at our pH, remember we said it was alkalotic, so we have respiratory alkalosis. Same thing with the 7.20, that is acidotic reading because it is lower than our range. The PCO2 is 66. That is higher than the normal PCO range. And then when we look at the HCO3, that is actually within normal limits, so that we know what is causing the problem is our PCO2, which is our respiratory system, and we know that it's acidosis, so we have respiratory acidosis. The next one, 7.11, is that acidosis or is that alkalosis? It is acidosis because it is on the low end. We look at the PCO2, is that high, low, or normal, and we see that that is actually within range, so that's normal. Then we look at our bicarb, and it is 13. 13 is lower, it's out of our range, so our bicarb is what's causing the problem, and if the bicarb is what's causing the problem, then it is metabolic, and we said that our pH was acidotic, so we have metabolic acidosis. With the 7.52, the same thing. We look at the PCO2 of 37. That's actually normal within the range. And when we look at the bicarb, that's 30. And we know that that is out of our range. So we know that's what's causing our problem. It's metabolic. And when we look back at our pH, we know that it's alkalotic. So we have metabolic alkalosis. So how did you do on choosing what the problem was? Okay, so that's how you determine the readings on respiratory alkalosis and acidosis and metabolic acidosis and metabolic alkalosis. So let's throw another wrench in. Let's talk about compensation. Acidosis or alkalosis, the body will attempt to restore a normal pH. No matter what is going on in our body at any given time in the world, our body tries to fight itself and go back to homeostasis, which we all know is the state of normalcy, so to speak, that our body wants to live in constantly. So we always try to get back to a normal pH, which is 7.40, by altering the system that is not the original cause of the pH imbalance. Okay? And you need to know that your body will never overcompensate. It's a pretty amazing thing. So with compensation, if your pH is within normal range, and by now you should have memorized that your pH is 7.35 to 7.45, but your PCO2 and your bicarb, or your HCO3, are abnormal, then compensation has occurred. Okay? So if my pH is normal, but my other two are abnormal, then compensation has occurred. What you just learned prior to this slide was that your pH was abnormal and one of the other two were abnormal and one were normal. And that way you could tell if it's respiratory, metabolic. Now we have a normal pH, but the other two are abnormal. So that's when we're talking about compensation. Okay, so let's look at this together. This shows the compensation progression and how it actually works. So the very first line on here is what we have learned. We have a pH that is 7.55. That 7.55 is elevated. It's not normal. Our PCO2 is 30. And remember that our normal there was 35 to 45, so that means that it is decreased, which is not normal. But our bicarb, which is 24, is actually within normal range. Okay? So our body wants us to get back to normal range. So in order to do that, remember a couple slides ago, I told you that our body always alters the system that is not causing the problem. So in this situation, the PCO2 is what's abnormal. So that is what is causing our problem. So our body's going to say, hey, bicarb, I need some help over here. Come in and help me. Okay? So then you look at the next line down where you can see that the bicarb is trying to change to help get that pH back to normal. So our bicarb has decreased in order to bring our pH down, because remember in the beginning when we talked, if our pH is down, our bicarb is down. Okay, because they have the direct relationship. If our pH is down, then our CO2 would go up because they have the indirect relationship. So we want our bicarb to come in and help us compensate and get this fixed. So now our bicarb, our body has said, hey, I need you to drop. So the bicarb has dropped from 24 to 21.7, which in turn dropped my pH to 7.48 from 7.55. Now, 7.48 is still not in normal range, so we're still working. We're still trying to get it down to our normal range. So the body says, hey, bicarb, I need you to drop just a little bit lower. So the bicarb drops to 19.3. And at this point, that causes my pH to also drop, and I have a pH of 7.43. So I have a pH of 7.43. My bicarb is 19.3, which you know is abnormal, and it's low. And my PCO2 is still low because I have a problem in my respiratory system. So I have the two abnormals with the normal pH, and when you have two abnormals with a normal pH, compensation has occurred. Okay, so let's try another slide. Try to pause this slide, try to figure this out on your own, and then replay it and listen to what I'm going to talk you through. We look at the 7.28 pH. We know that that is not normal. It's out of our range of 7.35 to 7.45. So we go across the board. Our PCO2 is 40. Is that normal? That is normal because our range for our PCO2 is 35 to 45. These ranges you guys will have to memorize. You need to know the numbers for the ranges of the pH, the PCO2, and the HCO3. When we look at our HCO3 or our bicarb, as I refer to it, we show that it is a number 18. We know that 18 is low because our normal is 22 to 26. So now our body wants us to have homeostasis. We always have to have that pH normal. So our body's going to kick in and say, hey, I need some help here. So our problem child in this situation is our bicarb, because it's 18 and it's low. So the body's going to go to the respiratory system and say, hey, I need a little help here. So the respiratory system drops down, the PCO2 drops down to 34. When the PCO2 drops down, remember PCO2 and pH have an inverse relationship. That means pH goes up. So you can see on that line that my pH went from 7.28 to 7.33, and that the PCO2 has decreased to 34, whereas the bicarb is still the same, because that's our problem child in this scenario. Then on the very last line, you see that 7.37, that is within normal range, and our PCO2 actually dropped to 32 to make the pH increase to the 7.37, and our bicarb is at 18. And when you look at that last line, you realize that your PCO2 is abnormal, you realize that your bicarb is abnormal, your pH is normal, so therefore compensation has occurred. So if all you saw written down somewhere was the 7.37, the 32, and 18, then you would know that there is compensation occurring. So we just learned what compensation was, so now we have to look at it a little bit further to see about the respiratory or the metabolic component of it. We know that if our pH is within normal range, but our CO2 and our bicarb are abnormal, then compensation has occurred. So the very first thing that we need to do is look at which side of 7.40 the pH is on. If it's 7.35 to 7.39, then the initial problem is acidosis, because that's on the low end of pH, which if we go to the low end is acidotic. And then just the opposite, 7.41 to 7.45, the initial problem is alkalotic or alkalosis, and we know that because that's on the higher side of the pH, and we know if our pH is up, then it is alkalotic. The next thing that we have to do is match the system that matches the acidosis or the alkalosis. So I want you to look at this slide on compensation. Take out a little scratch piece of paper and a pen and write this down as you go through the example. And the first thing that you need to ask yourself is the pH normal? Yes or no? Is the PCO2 and the bicarb abnormal? And you need to answer that to yourself. You've got to know your ranges and write those down. Then you need to know which side of 7.40 is the pH on. Is it an acid or is it an alkalotic? By looking at 7.39, and you may need to refer back to the slide before to see those ranges. So then ask yourself which system it matches. Try to work this out before going on to the next slide. Okay, so this slide has the answers for the compensation. The first thing that you ask yourself is your pH normal? Yes, it is. Is the PCO2 and the bicarb abnormal? Yes, it is. So which side of the 7.40 is the pH on? So we know that 7.39 is on the lower side of 7.40, and that means that it is an acid. So which one of the systems does it match? When you look at your bicarb and your CO2 up above, which one of those two does the acid match? And when you look at the bicarb, you'll see that it matches that as an acid, which means it's metabolic.
Still gonna bother you with the type?
Okay, so here's another slide. This is just for practice. Go ahead and try to figure these out on your own. Push pause on here, write your answers down, and once you have them down, then push play again, and I will have the correct answers for you. Okay, so hopefully going through these, the questions that you ask yourself is the pH normal? So you'll look at the pHs and actually can just glance down through there and see that all of those pHs are normal. Then you want to look at your CO2, PCO2 and your bicarb and see if they are normal. And we'll just use the first one as an example. Please bring your answers to class and we will discuss this further for the rest of the list there. But you look at PCO2 of 52, and is that normal? No, it is not. It is out of the range, and it is actually elevated. So we learned that if we have the elevated CO2, then it is acidotic. We look at the bicarb, which is 36, and is it within normal range? No, it is elevated, and we have previously learned that if it is elevated, then it would be alkalotic, or the base. So we know compensation has occurred because we have a normal pH and we have an abnormal PCO2 and an abnormal bicarb. So then we just have to look and see, does the bicarb or the PCO2 match the pH? And we know that our PCO2 is the acid, and that does match our pH, which is on the low side, which is acidotic. So therefore we have respiratory acidosis. So bring this slide with your answers to the rest of them to class, and we will go over them. Okay, so then this slide says mixed acid-base imbalance, when there is respiratory as well as metabolic component to the imbalance. So do these exist? Yes, they do exist. You can look at this and see that your pH is 7.60, so it is elevated and it would be base. Your PCO2 is 20, and that is decreased, and it is a base. And then your bicarb is 28, and that is increased, and so that is also a base. And so all three of those match. So what would the answer to this be? It would be that we have alkalosis because they're all bases, and we actually have respiratory and metabolic alkalosis in this case. Okay, so this is a review slide. I would like for you to figure these out, have these ABG readings written down, and when you come to class, we'll go over them to see if you have them correct. Now that you're a pro at reading ABGs, let's talk a little bit about the symptoms and what we're going to do about it. So first we're going to talk about the symptoms of acidosis and what would occur, the things that you would see. CNS depression, vasodilation, you'll see decreased cardiac output, decreased cardiac contractility, and sometimes you will see cardiac arrhythmias when acidosis. The symptoms of alkalosis, CNS excitability. With this one you see vasoconstriction, and again you'll have cardiac arrhythmias sometimes with alkalosis. What can cause respiratory acidosis? Respiratory disorders such as pneumonia, COPD, ARDS, pulmonary embolism, pulmonary edema, Pickwickian syndrome. If you don't know what Pickwickian syndrome is, look that up. We'll discuss it more in class. Hypoventilation. What can cause respiratory alkalosis? With this one we have hyperventilation, CNS disturbances, sepsis, high rates on the ventilator, disturbance in your respiratory centers. Okay, what can cause metabolic acidosis? This is usually seen when we have renal failure, decreased bicarb, or an increase in acids. And we have an increase in acids, you know that your pH level drops, your number drops. Also ketoacidosis can cause this, ketoacidosis, apologize for mispronunciation. Lactic acidosis, if we lose bicarb, like through diarrhea, and possible renal failure, which we already talked about that. Usually with acidosis, our respiratory rate's going to increase, because if we increase, that means we're blowing off more CO2, which is an acid, and if we can get that out, then that means that we can decrease the acidosis. Okay, so with what can cause your metabolic alkalosis? If we have an increased bicarb or decreased acid, such as vomiting, NG drainage, massive blood transfusions, administration of IV bicarb. If we have alkalosis, our respiratory rate usually decreases, or we want it to decrease, so that it will cause the CO2 to be retained. And if our CO2 is retained, it is an acid, which means that it will increase the acid load and hopefully level out that alkalotic and acidosis imbalance. The treatment of respiratory acidosis, obviously with anything, we want to treat our underlying cause. We've got to find out what's causing the problem in the first place, or we're just putting a band-aid on it. So we want to try to treat our underlying problem. We want to do pulmonary toileting, bronchodilators, mechanical ventilation. We may have to increase our rate or possibly our tidal volume. Treatment of respiratory alkalosis. Sedation, we want to keep our patient calm. Sometimes you'll see them use a paper bag because of the blowing too much CO2. We want to increase our FiO2. We want, again, to treat our underlying problem. That should be our number one thing. Again, you may see a ventilator, and this time you're going to see a decrease in rate, whereas before you saw an increase in the rate. Treatment of metabolic acidosis, administration of sodium bicarb. We obviously, again, want to treat the underlying cause, and we want to improve our tissue. The treatment of the metabolic alkalosis, again, it's always treat the underlying cause, but we would stop administration of our bicarb, antacids, anything that may cause that to increase. Arterial oxygenation, that is determined by our partial pressure of oxygen, or our PO2, and our SaO2, and our SaO2 is our oxygen saturation. Arterial oxygenation, or our PO2, it's a result obtained from the ABG. It's partial pressure of oxygen dissolved in the arterial blood, and the normal range is 80 to 100, and you'll see that hopefully when we're in clinical we'll be able to review those more. Arterial oxygenation SaO2, it's a result obtained from pulse oximetry. We measure the amount of O2 that is bound to our hemoglobin, and our normal range of that is 95 to 100. Now you may see a normal range a little bit lower that when we're in the clinical setting. That's going to depend on your patient condition, and we'll look at our patients and our orders to see that. Sometimes the doctors will even accept as low as 90%. Symptoms of hypoxia. With acute hypoxia, you'll see restlessness, confusion, tachycardia, tachypnea, dyspnea. With chronic, you would see finger clubbing. What can cause a low PO2? Obviously respiratory disorders, congestive heart failure, congenital heart diseases. Again, you'll see that Pickwickian syndrome in there. It's anything that does not adequate perfusion, then we're going to see this problem. So what are we going to do to treat it? First and foremost, treat the underlying problem. We always want to figure out what's going on and try to get that fixed. Then we want to increase our FiO2 if we can. FiO2 just means your fraction of inspired oxygen. So we may increase O2 on the patient in order to increase this. We may add PEEP or CPAP. If you don't know what those things are, please look those up and we'll discuss those more in class. CPAP does stand for continuous positive airway pressure, and PEEP stands for positive end expiratory pressure. Increase your rate or volume on the ventilator, and obviously pulmonary toileting. And one final thought that you want to think about, you always want to monitor your electrolytes and your lab levels. The relationship between potassium and your pH. For every decrease of pH by 0.1, there will be an increase of potassium by 0.6. And just the opposite, for every increase of your pH by 0.1, there will be a decrease in your potassium of 0.6. So always remember that as your pH decreases, then your potassium will go up, and as your pH increases, your potassium will decrease or will go down.